I want to spend some more time talking about the issues addressed. What is an issue addressed? In my field work, I found that in about 2/3 of the visits, it was really straightforward. The patient said, I'm here for my blood pressure medicine and my rash. And it was really clear what those were, and so those were two issues, and there was no disagreement or confusion. On the other hand, in about 1/3 of the visits, it was a little more nebulous. It was a little more complex. So how do you manage that? Well, first of all, if the patient comes in with something pretty straightforward, like my belly hurts, and then you decide they have reflux, then no fair sort of putting down both issues as separate issues. Veer towards the side of calling it the diagnosis if you can, but if you can't, of course, leave it as a symptom just the way we do now. But what if the patient says, Dr. Young, I've been falling apart, my chest hurts, my eyes are not working, my skin's turning orange, my hair is falling out, and the first question out of your mouth is, are you still taking your Zoloft? And they say, no, I'm not. And then off you go from that point, really dealing more with their anxiety or depression or whatever you think it is. On the other hand, if when they said chest pain, you went, oh, haven't heard that one before, and you start asking location, onset, duration, quality, all that sort of stuff to really understand their chest pain, then that's allowed to be classified as a separate issue on top of the anxiety disorder that is the real driver of why the patient doesn't feel well. What is a brief issue addressed? I think there's a lot of times when people have had especially stable chronic diseases, they're doing really well. It shouldn't take you very long to get a good understanding of that. So let's say someone's been on thyroid medicine for 10 years at the same dose, and you ask questions like, any problems with your meds, any skin changes, how are you sleeping, how's your energy, whatever else you want to ask, and the patient basically goes, yep, everything's great, feel wonderful, then I say, why ask anything else? There's really nothing else to gain from that. And so that would be, to me, an example of a brief issue addressed. Finally, I do think there's some things that are so quick that you really shouldn't build patience for. So for example, if somebody says, hey, what's this lesion on my arm? You say a skin tag and that's it. Then that took you 5 seconds, and so don't charge them for that. On the other hand, if then the patient goes, what is it? Is it dangerous? Is it cancer? Could you cut it off? Would it scar? That sort of thing, well then okay, now you're getting into it, now you're having to use your medical expertise to advise the patient on their options, so now it becomes a billable issue addressed.